Hello friends, today we are going to discuss about Telepsychiatry Operational Guidelines Basics. I am Dr. Suresh Bada, Professor of Psychiatry working at NIMANS, Bangalore. Before I start my presentation, I would like to have a disclaimer. This presentation is for academic and training purpose only. If you want to have a legal opinion, please do contact an advocate. This presentation is not a substitute for legal opinion. At the same time, I request you all to go through the original Telemedicine Practice Guideline released by Ministry of Health and Family Welfare on 25th March 2020. Telepsychiatry Operational Guideline 2020. This was prepared by NIMANS, Bangalore in association with Telemedicine Society of India and Indian Psychiatry Society. This guideline is available online free of cost. This guideline has 8 different chapters. First chapter is what was the need and the legality of telepsychiatry operational guidelines. Second one is advertisement and social media. Third one is technology of telepsychiatry. Fourth is the important chapter which we are going to discuss about medical records, especially with regard to telepsychiatry. Fifth one is stepwise operational guidelines for telepsychiatric consultation. That is, before the telepsychiatric consultation, during the consultation, and after the consultation, what the psychiatrist has to do. Along with this, we will be discussing the 6th chapter on teletriage. That is, basically first consult, follow-up consult, telepsychiatric consultation initiated by the family member, the next one will be healthcare workers, and proxy consultation. The 7th chapter is prescribing medication in telepsychiatry. Finally, telepsychotherapy will be discussed. Let's move into the first chapter, the legality of telepsychiatry. What was the need of this Telepsychiatry Operational Guidelines 2020? Please do remember, Telemedicine Practice Guideline 2020 was released on 25th March 2020. Before that, we also had a legislation very specific for practicing psychiatry. So now, this Telepsychiatry Operational Guideline is going to give you a roadmap to practice psychiatry online with regarding to taking into account of Telemedicine Practice Guideline and also at the same time Mental Health Care Act of 2017. And this guideline is not a standalone document. It has to be clearly read with all other documents. This guideline should be used in conjunction with any national standard operating procedures, clinical practice guideline, any other laws, procedures, ethical regulation, and telemedicine practice guideline needs to be followed. You cannot say that I'm just following telemedicine practice guideline. This is an addition to all other laws which are prevailing at this point of time. The psychiatrist shall observe the laws of the country when practicing telepsychiatry. Finally, my dear friends, all the laws which are applicable for in-person consultation in psychiatry is also applicable in telepsychiatry. You cannot just say that I'm following telemedicine and I'll not be able to follow Mental Health Care Act. It is you have to follow all other laws which are applicable in person is also applicable on telemedicine. Let's move into the chapter 2, advertisement and telepsychiatry. Imagine immediately after COVID, you want to switch over to telepsychiatric consultation. How would you like to tell your clients or the patients that you are going to practice telepsychiatry? In this regard, how do you provide information on telepsychiatric consultation to the clients or else prospective clients or the patients? Please do remember, Indian Medical Council Ethics Regulation 2002, which is also part of National Medical Commission Act 2019. According to that, it clearly says that the code 6.1.1 clearly says that soliciting of patients directly or indirectly by a physician or by a group of physicians or by an institutions or by an organization is unethical. That means you cannot do advertisement. That means you cannot advertise telling that I am doing telepsychiatry practice, please come to me. Means soliciting of patient by any means of advertisement, either on social media, on internet, will be causing grave problem to your practice. But however, the same Indian Medical Council Ethics Guideline 6.1.1 also says that a medical practitioner is, however, permitted to make formal announcement in press regarding starting of a practice, starting of a change of practice, or a change in address, or resumption of another practice. So, if you look at the code 2, 3, and 5, they fall into the category that you are changing the type of practice from in-person to online. So, you can do once advertisement. At the same time, changing address. Of course, you are changing from in-person to online consultation, and online consultation address can be provided. That is basically your login ID and credentials. Resumption of another practice also comes into this phenomena. So you have to be very careful. Only during this change in from one practice to another practice, it is allowed. Otherwise, by any means, soliciting patients through advertisement is not allowed. Here it is allowed for providing information for change of practice, change of address, resumption of another type of practice. So under that pretext, you can provide information, not an advertisement. Advertisement is more of a commercial in nature, soliciting patients, and with a clear mandate to increase the number of patients, which is unethical. Providing information is giving information, telling that I'm not doing practice in person, but I have switched over to online practice. So that is information giving, and it does not mean that you're soliciting patients. Informing patient about the telemedicine practice. How do we go about? The best way to go about is not to do advertisement. However, you have to be very clear. You will do publicity for the time period when you are changing from one practice to another practice. The best way is giving information on the prescription, or else on the visiting card, or by word of mouth is the best way. Do not do advertisement on social media, internet, and other ways of doing those things will definitely attract penal provisions of removing your license. Hence, be careful how you provide information on social media. At the same time, you need to keep a professional boundaries between your personal social media account and the professional social media account. Please do keep the social media account of yours personal versus professional social media account completely separate. You can have two accounts where one of them is for personal reasons for your family and friends. One is very specific for professional purpose. Don't mix them both because the boundaries becomes very blur. At the same time, have two different dedicated phone numbers, one for personal reason, another for professional reason. And whenever the patient requests for social media account, please do provide them the professional account, not the personal account, because social media is a powerful tool to provide psychoeducation, providing information. At the same time, when you are available, when you are not available, those kinds of information can be provided through social media. And please do remember, World Health Organization has clearly said that social media is a powerful tool to reduce stigma and improve education among persons with mental illness and their family members. At the same time, never ever share patients' data on social media with regarding their picture, clinical data, or maybe X-ray or any other clinical data on social media without the consent. Even if you are going to take a consent, it should be irrevocable consent, explaining once the information goes out of your either laptop or the mobile, it is very difficult to stop them. For example, if you have taken a picture of the patient regarding an illness and you have circulated in the social media, either maybe WhatsApp, Facebook, Instagram, once it goes out of your mobile phone to the other accounts, it's very difficult to get back. You cannot stop the spreading of those maybe videos or photographs. Hence, you have to explain the patient and it is irrevocable. And the patient wants to stop it, the psychiatrist cannot stop the spread of those messages or maybe the photographs. And be very careful when you make comments on social media with regard to your colleagues, with your subordinates, about your students, and about your patients. Be very careful. So you have to behave very, very responsibly when you are in the social media. It is almost equivalent to the way you behave with the same person when he is in person, when you are talking to him. When in his absence, never make comments in social media, or else, even if he is there, be very, very gentle and be very professional, either when you are dealing with the patient or with your professional colleague. At the same time, your online presence should not considered as advertisement. Be very careful. Do not ask your patients to rate you, asking for voting, asking for self-endorsement, and also patient writing. This is one of the best patient doctor I have come across. Those kinds of endorsement should be stopped because they all means you're advertising, you're endorsing your professional career, which can definitely invite for ethical dilemma or else a penal provision of removing your license. Let's move into the chapter 3. It is on technology requirement to start telepsychiatry practice. Please remember, it is not the technology, the hardware, the software, what the doctor can learn and use it. That's not the yardstick. The yardstick is the hardware and the software, what the patient can learn and use very freely and also very easily. That means user interface should not require much of training. As much as zero requirement of training would be the best. And even the requirement of hardware should be very less, and the yardstick should be the user's interface should be as simple, as easy, as cheaper or economical, and requirement of hardware should be very less on the side of the patient. That is on the user side. The doctor side also, if it is very simple and the doctor need not go any training and also does not require any higher amount of training, is the best software. Hence, the yardstick is the patient requirement. It's not the doctor requirement. The key requirement in telepsychiatry is internet connection. Have at least 2 to 3 service provider. A chance one of the service provider goes off, you can switch over to the another service provider. At least 512 kbps is required. And if you have 2 Mbps, I would request or recommend 2 Mbps. And preferably have both. One is cabled, another one is a Wi-Fi. Nowadays, Wi-Fi 2.4 and 5 GHz are available. If the router is kept very close, 5 GHz is the best. Regarding what is the best hardware to be planned or bought, invest in good HD camera, the camera which is very good in quality, plug and play was the best. Place the camera at the eye level. Don't keep it very high or low. So keeping at the eye level makes the eye contact very easily. Whenever you talk to the patient, don't look into the monitor. Please look into the eye of the camera so that it maintains eye contact with the patient. And looking into the camera is a very important skill which you should learn over a period of time. At the same time, invest in very good audio mic. At the same time, the room which you are going to use for telemedicine consultation or telepsychiatric consultation should be as much as soundproof, and also it should be quiet. If possible, isolated place would be the best. Headphones would be the best along with the cuff so that nobody else will be able to listen to the conversation what the patient is speaking to the psychiatrist. Coming to the lighting. Lighting is a very essential component with regard to telepsychiatric consultation. There should be enough of lighting. If possible, warm white LED should be there along with the Kelvin of somewhere around 3000 to 4000 Kelvin lights is very essential. Avoid placing the camera directly in front of the windows. It should be placed directly behind the windows so that the light falls on the psychiatrist's face. I would advise to have the lights which are artificial. That is basically you can control the lights. If you are relying on the natural lights for the provision of lighting, then it will be very difficult, especially if you are doing consultation early in the morning or in the evening. The best way to have a lights which are basically three in nature, which I'm going to discuss now. At the same time, having the background which is not shiny, which reflects back into the camera. The background should be non-reflective matted surface, which will give you very good non-reflective surface for doing telemedicine consultation. And having a 3-point lighting is very essential. Having the two lights in front of the psychiatrist will show the light on both the side of the face, so there is no shadow. At the same time, having another light behind the psychiatrist so that the background is well lit. So 3-point lighting is one of the best. Coming to the telepsychiatry chamber, where should be the chamber placed? The chamber should be placed near to the OPD, wherever the psychiatrist does the consultation. Never ever keep the telemedicine consultation chamber away from the OPD. Whenever the psychiatrist wants to do telepsychiatric consultation, he should not walk around 100 or 200 meters away from the OPD counter. It should be as much as near to the consultation, in-person consultation chamber. If preferably, I would request you to have a telepsychiatric consultation where the in-person consultation is also kept. Having the wooden furniture and the floor mats decreases the echo so that the sound quality will be very good. Having the camera faced directly towards the face of the psychiatrist will help you so that the patient who are coming for in-person consultation should not think that they are recording the consultation. At the same time, the telemedicine consultation chamber should be as real as possible to the in-person consultation chamber, as professional as possible. If you are doing telemedicine consultation from your home, please do make it as normal and as possible equivalent to your chamber, and wear professional clothes. Having a formal dress is very essential. Just because you are doing telepsychiatric consultation do not mean that you'll be coming with informal dress. Sitting shabbily should not be there. You have to be highly professional, and you will give as much as respect the way you do in-person consultation. Same thing you will do. And one more important is having a spectacles with non-reflective or anti-glare is very essential. Otherwise, the light falling on the glasses will reflect on the camera, and that comes in the way of maintaining eye contact with the patient. Moving to chapter 4, that is medical records. As per Telepsychiatry Practice Guideline and also Telemedicine Practice Guideline, EHR, Electronic Health Record, EMR, Electronic Medical Records are not mandatory. You can write the notes directly into the patient's file, and you can do the telemedicine consultation either using audio, video, or else even email. And you can enter the data directly into the patient's file, that is the physical file, and keep the copy of the prescription whenever you do the prescription to the patient. At the same time, follow the prescription which is advised by Telemedicine Practice Guideline. I'll be discussing this about the prescription in the next video. At the same time, never ever forget to follow Mental Health Care Act 2017, Section 25, which mandates every psychiatrist to keep the basic medical records of OPD. So that basic medical records need to be stored, and whenever the patient is requesting for it, and you have to provide it. You cannot refuse. As per Section 25 of Mental Health Care Act, it clearly says that it is the right to basic medical records is for patients, and you will be providing those basic medical records only to the patient. This is how the basic medical record proforma looks like it, and this is as per the Rule 6, subsection 3, Form B. This is the OPD requirement, and it also says that you have to keep a hard copy of the format. And if you are able to have a cloud format, no problem, but the physical format is required. Access to basic medical record, or to get those medical records, the patient will give an authorization letter, and that letter will be as per the Section 25 of the Mental Health Care Act in the prescribed format. The patient record shall be given only to the patient, not to any other person. And you have to be very clear. Securing the devices of telemedicine practice is very essential. Especially the various research done in US and UK have clearly said that the data breach or else the important information which are leaked into the social media or into the virtual world is basically the psychiatrist or the doctor has lost his laptop which is used for providing services. Hence, whenever the psychiatrist providing telepsychiatry consultation, he has to make sure those laptops which is using for consultation should be secured and it should be under his custody. Unauthorized access of these laptops or these instruments should be prohibited. At the same time, you have to enable secure disabling or wiping the uh, hard disk if by chance if there is a theft of your laptop. And most of the time, the data breach occurs whenever the other person gets access to your laptop. Most commonly, it has also been seen the doctor is providing telemedicine practice guideline in the daytime. In the evening, his laptop is used by either his child or his family member or his wife. By mistake, they may transmit the data of the patient to somebody else. That should not happen. At the same time, you have to make sure the audio or video recording either of the client or of the doctor has to be occurred under the explicit consent. Under no circumstances, covert recording of audio or video is prohibited on both the side. At the same time, chamber consultation keep the camera of the telemedicine consultation facing the psychiatrist, not towards the patient, because during in-person consultation, the patient should not see that there is a camera kept facing him, and many a time patient becomes paranoid thinking that they are recording the consultation. Hence, keep those cameras facing the psychiatrist away from the patient. Let's move into the chapter 5. That is telepsychiatry consultation. What will you do before the consultation, during the consultation, and after the consultation? During the pre-consultation, the consultation should be based upon appointment. It should be planned. It should not be random. And at the same time, when the telemedicine consultation or telepsychiatry consultation is done, alternate contact details, by chance if there is a change in appointment or if there is any technical glitches, has to be provided both side, from the patient and also from the psychiatrist side, because the technical glitch can occur at the psychiatrist or at the patient end. And also, please do explain about the emergency consultation before in hand. I will be discussing about emergency consultation shortly. At the same time, telemedicine consultation details has to be provided, and also you have to talk to the patient. Do's and don'ts has to be explained to the patient and the patient party. And at the same time, you can provide soft copy of the telemedicine practice guideline to the patient and the patient party. Consent form can be sent to the patient so that he can sign and come back when the teleconsultation is done. Also, you can also provide following documents to the patient. These following documents are optional. I will repeat, these documents are optional, not mandatory. This is how the first consult documents looks like this. If you look that, we have made it as optional. If the patient and the party are highly educated, you can send this pro forma to the patient and the patient party. Let them fill these information, including name, demographic details, what are the chief complaints, and where the location of the patient and the family member. You can also use these diagrams to locate the symptoms, and you can also provide past history, present history, and also marital history. The eighth point is very, very essential. The eighth point is you are asking the patient, please tell me, is there any legal conflict, or else is there any conflict with the law, or else you require any certificate. At the same time, remaining will be filled by the patient, the last part to be filled by the psychiatrist. This optional document is very helpful to get those records written by the patient or by the family members. Along with this, pro forma, you'll be sending the consent form, which is very detailed, and the patient and the patient party is going to sign this. Please do send the documents of do's and don'ts for telepsychiatric consultation. You can also mention telemedicine consultation is only through either text, audio, or video, and if you are going to charge for audio and video or even for the email, can be clearly explicitly told. And you can also ask them to fill the proforma and send it to you before the telemedicine consultation. Request the patient's party to upload the government ID. At the same time, to upload the previous treatment details, and also if they have taken any consultation with other psychiatrist or he has been admitted, those documents can be uploaded so that it is available for the psychiatrist before he does telepsychiatric consultation. At the same time, you'll also mention the duration of consultation is very fixed, and if he wants to have more time, he can ask for one more consultation. At the same time, you also need to make aware of them the limitation of telepsychiatric consultation. At the same time, patient has the right to choose in-person consultation instead of telepsychiatric consultation. The same right is also given to the psychiatrist. The psychiatrist can refuse to provide consultation on telepsychiatry, and he can request the patient to come for in-person consultation. That means on both the side, they have their rights and they can call off the telepsychiatric consultation anytime and can request for in-person consultation. At the same time, it is the doctor's discretion to choose what kind of consultation he is going to do, whether it is audio, video, or else maybe the other platform if he is going to use. A copy of the telemedicine practice guideline should be sent to the patient and the patient party. And at every time when you do the telemedicine consultation, you need to talk to the patient and ask them whether they are comfortable when they are starting the teleconsultation. And every touch base, you are going to ask for the identity of the patient and also the government issued ID card. And also, presence of patient is essential for the first consultation. Coming to the follow-up consultation. Again, for the follow-up consultation, there is a proforma which is made available, and that proforma is also optional. It is not mandatory. The family and the patient party are well versed. They can fill this proforma and send to the doctor. Along with this, he can fill the demographic details. The doctor will verify the ID. Last in-person consultation has to be documented. Improvement, previous consultation and prescription can be added. Along with this, if the patient has any side effects, and also every follow-up, you are going to ask for any legal or any pending legal inquiry or else any departmental inquiry. By means, any kind of conflict with law needs to be documented. If it is not there, you will say the patient denied of any legal issues. Family table, family marital discord, and any other information they wish to share can be used for this follow-up proforma. Coming to during the consultation, what will happen? During the consultation, in case if there is any internet connectivity or technical glitches, the psychiatrist had to decide if there is a technical glitch either on the doctor side or in the patient side. In the initial part of the consultation will be aborted. A text message or else an audio call will be made to the patient and a different consultation time will be given. By chance, if it occurs at the end of the consultation, then he can continue with the audio consultation and provide prescription. At the same time, once the consultation is over, please plan for a follow-up and a new date will be given and which will be marked for the patient and also to the psychiatrist so that the slot is fixed before in hand. Further, after the consultation, once the consultation is over, he will be clearly documenting, making the prescription. That prescription will be as per the Telemedicine Practice Guideline 2020 format. A copy will be retained. A soft copy will be sent to the patient either by taking the photograph or scanning the prescription. It will be sent to the patient. And when the prescription is writing, he should also make sure lifestyle changes can be advocated like diet change, exercise, avoiding substance use. Those are the information can be provided. At the same time, the psychiatrist can use this feedback proforma, which is again optional, which can be sent to the patient, and the patient will document this by marking what was the video quality, audio quality, communication, prescription explained or not, side effect explained or not. Any suggestion can be used for to be given to the patient so that the patient will be providing the feedback how the consultation was. If there is any problem in the rating, the psychiatrist or his colleagues or it may be his subordinates can call the patient and ask, You have made a tick telling that the communication was worst. Please do know, please do tell us, was the communication was so bad, whether whatever the discussion occurred, whether he understood or not. If he says it is not understood, please rectify it and you can have a one more consultation. Please remember, if the patient requires, once the consultation is over, online investigation. Online investigation can be raised and directly sent to the patient. Those investigation can be carried out by the patient from the in-person in the nearest lab. Please do remember, my dear friends, the requisitions sent online or by WhatsApp or social media to the patient, those investigation will be honored by the laboratories for the purpose of doing investigation. At the same time, if the patient requires general physical examination, the doctor can refer him to the nearest in-person consultation medical officer or else even to the laboratories where the general physician is available. And please do remember, never ever forget, follow the clinical practice guideline when the prescription is written, or else any investigation has to be done before starting a medicine or before diagnosing. Those clinical practice guideline has to be followed by the psychiatrist. And coming to the last part of my presentation, which is emergency telepsychiatric consultation. By chance, if the patient says that he wants an emergency consultation and there is an emergency situation, in such a scenario, telemedicine practice guideline is very clear. It clearly prohibits the psychiatrist to engage a patient in emergency situation. In the emergency situation, the psychiatrist will advise first aid, will do counseling, and facilitate referral for in-person consultation. Please do remember, again I will repeat, in case of emergency, patient will be advised for first aid, counseling will be done, and facilitate the referral to in-person consultation. This has to be done very sensitively. At the same time, the doctor will record all his statement and advice in the document, and a referral letter will be given to the patient. Please do remember, the rule of thumb is in-person consultation is for emergency care, not telepsychiatry. So, whenever there is an emergency, please do refer them for in-person consultation with the nearest registered medical practitioner. At the same time, if the patient is seeking telemedicine consultation during odd hours, maybe in the night around 2 o'clock, 1 o'clock, or maybe in the early morning 3 o'clock, in such a scenario, the doctor can choose either to attend the call or not to attend the call. It is the professional discretion of the doctor to decide to give consultation or not consultation. Not attending the patient in the odd hours is not ethical violation. Let's move into chapter 6, telepsychiatry practice. In this chapter, we are going to discuss about first consultation, follow-up consultation, telepsychiatric consultation initiated by the family member, with the patient, without patient. There is a third, healthcare worker consulting the psychiatrist through telemedicine. And this is usually by the home visit, and the consultation is collaborative video consultation. These are the issues which we are going to discuss in this chapter. Now we will discuss about first consult. First consultation means the patient has contacted the psychiatrist for the first time in his life. That is first consult. Also, if the patient had contacted the psychiatrist, if it is more than 6 months back, then also it is first consult. The third point is, if the patient had contacted recently, again is contacting the psychiatrist for different health reasons, then also it is considered as first consult. For example, if the patient had contacted the psychiatrist for treatment of seizure 1 month back and again he is contacted now, treatment of depression, there are two entirely different health reasons, then it is also called as first consult. Let's understand step by step. The patient is contacting the psychiatrist either by sending a message or by an email, or else he may even make a phone call or a video call. As soon as the patient contacts the psychiatrist, is implied consent. Once he has contacted, the psychiatrist will send certain formas, first consult pro forma, which is an optional. Do's and don'ts in telepsychiatry. Again, the information is given to the patient. And requisition for ID card will be placed. At the same time, past treatment details, investigation, anything required will be requested at this point of time. Once the patient fills the proforma and sends to the psychiatrist, a appointment will be given. On the day of the appointment, the psychiatrist will prepare himself, and once the consultation starts, he will identify himself. At the same time, he will identify the patient by asking for various government issued IDs. Once the psychiatrist is satisfied about the patient, he will continue with the consultation. Immediately, he will check whether there is a emergency care is needed. If there is a emergency care is needed, first aid advice will be given, counseling will be done, and request for in-person consultation referral will be done immediately. If there is no emergency care is required, detailed assessment and investigation will proceed. Once the detailed investigation or the detailed assessment is done, then the management will be having health education, counseling, and medication list O will be given. Medication list O is nothing but over-the-counter medication. By chance, if there is a video consultation, then list A medications can be given by the psychiatrist to the patient. And if by chance the patient has done the consultation today, within 2 or 3 days, if the patient requests for one more telemedicine consultation, will it be considered as tele-follow-up? No. It is still the first consult. It is not a tele-follow-up consultation. For follow-up consultation, there should be an in-person consultation in the past 6 months is the mandatory requirement as per the Telemedicine Practice Guideline 2020. Let's understand about follow-up telepsychiatry consult because it is very confusing to many of my colleagues. Follow-up consultation means within past 6 months, the patient should have contacted the psychiatrist for a treatment and he is doing tele-follow-up by online consultation. That means within 6 months, in-person consultation is required. However, there are 2 exclusions have been placed. If the psychiatrist is unable to remember the patient, then also it will become first consultation. Or else, if the patient is contacting the psychiatrist online for a different health condition, then also it is be considered as the first consultation. Let's understand step by step. The patient is going to contact the psychiatrist either by sending a request by message or else placing for an appointment through online. You may also make a phone call or a video call. As soon as the patient contacts the psychiatrist, it will be considered as implied consent. Once it is done, the psychiatrist will send certain proformas to the patient to fill up. Do's and don'ts, ID card, previous prescription, any investigation if it has been done in the past 6 months will be requested to be uploaded. Once it is done, an appointment will be given to the patient. On the day of appointment, the psychiatrist will check all his devices, go through all the documents, and then he will initiate the telepsychiatry consultation. As soon as he initiates, he will identify himself and also will request for government ID card from the patient. Once the patient is identified and he is comfortable, the telepsychiatry consultation continues. In the next stage, the psychiatrist will quickly assess whether the patient requires emergency care. If there is emergency care is required, you will be given first aid advice, counseling, and in-person consultation referral will be given. If there is no emergency care is required, detailed assessment and investigation is done. And these are the management or tele-follow-up is done. First and the foremost, health education. Second is counseling. The refill of medication will be done. That is, whatever medications given during in-person will be refilled during the tele-follow-up. At the same time, medication list B can be given by the psychiatrist to the patient. By chance, if there is a new complaint is the reason for consultation online, then it will be considered as new consult. And if it is a video consultation, you can give list A or else list O medications can be given. Now we will discuss the requirement to come for in-person consultation to be on tele-follow-up is at least 6 months once. That means in the past 6 months, the patient should meet the psychiatrist in person, real face-to-face consultation has to be there. During that time, investigation is done, general physical examination is done, and the tele-follow-up will be given. This is kept mandatory because every 6 months, some of the conditions requires investigations. At the same time, the real touch between the patient and the psychiatrist should be there. Hence, there is a mandatory requirement of 6 months once, at least for in-person consultation, has to be done for tele-follow-up. Now let's move into telepsychiatry triage. Triage is nothing but here the patient care will be given based on the priority. Here now there is a proxy consultation has been requested by the family member. It's basically a family member has initiated the telepsychiatry consultation. Here the family member can be nominated representative or else any other person authorized by the patient for telepsychiatry consultation. For this to happen, there should be very clearly an authorized letter with the informed consent as per the Appendix 4 in the Telepsychiatry Operational Guidelines has to be filled by the patient and handed over to the person who is going to do telepsychiatry consultation. That will be given to the psychiatrist. This is how authorization letter looks like. This has to be filled by the patient and will be signed by both the patient and the person, the NR, nominated representative, will be signing it, and that will be given to the psychiatrist. If the caregiver is initiating the telepsychiatry consultation, here the caregiver is a family member or any other person authorized by the patient to represent him. But however, here there are two situations. One is the caregiver has requested for a consultation along with the patient. Second one is the caregiver has requested for a telepsychiatry consultation in the absence of the patient. Again, that is followed if the patient is minor, less than 16 years, means the patient is a minor, the NR or the legal guardian will take the decision on behalf of the child. There, the telepsychiatry consultation can be done easily in the absence of the patient. However, if the psychiatrist wants to see the patient, definitely he can ask for in-person consultation, or else he would like to talk online, should be facilitated. Otherwise, the psychiatrist will refer them for in-person consultation. But however, the second important point is if the patient is incapacitated, is he has lost his mental capacity. This is a situation whether a caregiver can continue with the telepsychiatric consultation we'll be discussing. Let's discuss initiation of a telepsychiatric consultation by a family member when patient is present with them. This is how the telepsychiatric consultation is done when a family member and the patient both are there. When both of them are there, the psychiatrist will check for the ID of the patient, age proof, and also he will ask for any valid document establishing the relationship between the patient and the family member. If the patient is a child, is less than 16 years, and the clear-cut establishment of relationship is there, he is a guardian, legal guardian, or the parents, then the consultation will continue as per the will or the wish of the family member. If the patient is an adult, and if the patient is an adult, on capacity assessment, if the patient has capacity, then the consultation will proceed as per the will of the patient. During this process, the psychiatrist will assess whether the patient is comfortable discussing his issues in the presence of a third party. If he sees yes, the consultation will continue. If he places a reservation, the psychiatrist will request the other person, maybe caregiver or family member, to move out of the consultation chamber. By chance, if the patient doesn't have capacity, in such a scenario, if it is a first consult, then there will be a counseling will be done and they will be requested to come for in-person consultation. By chance, if it doesn't if it doesn't have capacity, but at the same time it is a follow-up consult, in such a scenario, the psychiatrist will check for any advance directive and he will follow the advance directive as per the wishes of the patient. And if he is very doubtful and he feels the patient is violent, the in-person consultation will be requested immediately. Initiation of a telepsychiatric consultation by a family member in the absence of a patient. All in-person consultation will be advised in the absence of a patient and it is a first consultation. Please do remember this. Very important point. For all in absentia, first consult should be in-person consultation. Let's go through the flow chart. If a caregiver has placed for a consultation in the absence of the patient, if it is a first consult, in-person consultation should be advised. If it is a tele-follow-up consultation, check for the authorization ID and the psychiatrist is able to establish the relationship between the patient and the family member. And if there is an authorization letter, tele-follow-up consultation will continue. If there are no proper documentation and the psychiatrist is not comfortable to give any consultation in the absence of the patient, can refuse and ask for in-person consultation. Now, let's spend time on discussing about proxy consultation and proxy prescription. Invariably, in all psychiatric settings, 30 to 40% of them will be proxy consultation and proxy prescription. But however, especially in telepsychiatry consultation, do not give prescription to a caregiver in the absence of the patient unless there is an authorization letter and there is a proof of ID of both the patient and the family member. And he is able to establish the relationship between patient and the family member and there is adequate documentation. Then only the proxy consultation will be honored. By chance, if the psychiatrist is not comfortable by the reason of professional discretion, he will request them for in-person consultation. Family members are requesting for a parenteral injection because patient is refusing for medication. What should a psychiatrist do? In such a scenario, the psychiatrist should request for in-person consultation. Whenever patient is refusing medication and the family members are requesting for parenteral injection and you do not know the mental capacity status of the patient, in such a scenario, it is advisable for in-person consultation. Avoid all those patients who have poor compliance on telepsychiatric consultation. Further, for injection, the Board of Governors of Telemedicine Practice Guidelines are very clear. They said that parenteral injection can be given only whenever the consultation is between a psychiatrist and another healthcare worker or with the RMP. It will be a collaborative video consultation. That means the healthcare worker will go to the patient's house. From there, he would have been doing the consultation. In such a scenario, when the healthcare worker is on the other side, the psychiatrist can issue the injectables. Otherwise, the psychiatrist is not authorized to give injection directly to the patient as a prescription because it requires a healthcare worker to deliver those injections. At the same time, please do remember, whenever such prescription is given to the healthcare worker and the healthcare worker is going to give the injection, the psychiatrist should remember about the vicarious liability. He should be confident about the skills of the nurse or the healthcare worker, and at the same time, he should clearly know that all the facilities are available when the parenteral injection is given. Now, one more important, which is very often requested by the family members of persons with mental illness. The patient is refusing to come to meet the psychiatrist or else refusing medication. In such a scenario, whether a healthcare worker can go to the patient's house and can he do a telepsychiatric consultation along with the psychiatrist? Of course, the healthcare workers are all those who are nurse, allied health professionals, mid-level healthcare practitioners, A&M, or any other health practitioners who are designated by the appropriate authority. And this healthcare worker can start a collaborative video consultation along with the psychiatrist, either from the home or maybe in a community or else from a satellite clinic or from a mobile medical unit. They can initiate this consultation from any part of the community. But however, it can be consulted to a private psychiatrist or to a public psychiatrist. And here, very important is the healthcare worker should obtain explicit consent from the patient. At the same time, if there is no informed consent, please refer them for in-person consultation. At the same time, healthcare worker and RMP, when the collaborative telepsychiatry consultation is done, both of them will ask for ID, identify them, and then the consultation will be given. This is how the process occurs. Healthcare worker in a community setting, he goes to the patient's house, will check for the ID of the patient, check for the information, will gather the information. At the same time, we will do capacity assessment. If the capacity is present and the patient gives a consent, we'll go ahead with the telepsychiatric consultation along with the patient. If the patient refuses telepsychiatric consultation, we will stop the consultation because the patient has capacity. By chance, if the patient doesn't have capacity, and if it is a first consultation, it will be referred for in-person consultation. He will check for if there is an advance directive. If the advance directive is there, he will follow the advance directive. If there is no advance directive, the psychiatrist will take the consent from the NR and he will proceed as per the Mental Health Care Act for providing care for persons with mental illness. Telepsychotherapy. The psychiatrists have been trained in providing psychotherapy. However, because of pandemic, online telepsychotherapy is becoming very popular. And here, the psychiatrist can do telepsychotherapy at the same time can also prescribe medication. Or else, he can keep it separately. That is, he can do a consultation for medication and he may do a psychotherapy later. That is after 1 week down the line. But however, before you resort to these kinds of telepsychotherapy, please do check for whether the patient is fit for telepsychotherapy. Check whether there is impulsivity, whether there is emergency care is required. In such a scenario, in-person consultation will be advised. In every session, the psychiatrist should check for any emergency care is required. And in every session, the psychiatrist will ask for ID of the patient. Only after positive identification, we will do telepsychotherapy. Here, the telepsychotherapy has been advocated by Telemedicine Practice Guideline by mentioning as counseling for specific clinical condition. So, cognitive behavioral therapy, wellness therapy, all those come under this category. At the same time, if you are going to have a caregiver during telepsychotherapy, please do take explicit consent from the patient. And again, all consultation should be pre-planned. Please avoid or refuse to provide emergency consultation. Please do inform them all emergency consultation will be given in-person consultation referral. In a scenario of an emergency situation, the psychiatrist will not be able to help them through telepsychotherapy or teleconsultation. Hence, in-person consultation is mandatory and a copy of the Telemedicine Practice Guideline can be given to the patient and the patient's family member. Please do remember about the basic medical record. Whenever the patient undergoes telepsychotherapy, the psychiatrist is mandated to keep a basic medical record. And whenever the patient requests for basic medical record on a case-to-case basis and for every session, psychiatrist should do the documentation and session notes should be available for the patient. And this is how the proforma of the counseling reporting form is here. This need to be filled for every session and should be made available whenever the patient asks for basic medical record. And the consent form for the telepsychotherapy looks very comprehensive and should be used. Now coming to the prescribing medication online. What are the different categories? How they are given? The prescribing list, there are four important: list O, A, B, and list C. List C is nothing but prohibited medication which cannot be given online. Coming to the list O. List O is over-the-counter medication, paracetamol, antacids, syrups, and vitamin. So these, for any type of consultation, list O can be given. List A is given for only video consultation for first consult and for any type of consultation or follow-up consult. That is mode I am talking about. Coming to the list B is a list of medication which RMP can prescribe in a patient who is undergoing follow-up consultation. That is, in the past 6 months, he has met the psychiatrist in person. In such a scenario, list B can be given for online consultation. Let's look into the matrix of permissible drug list. The first row is basically for the headings. The second row is list O. List O, any type of mode of consultation is allowed: audio, video, or text. The nature of consultation, it can be first consult or follow-up consult. Those are all list O, over-the-counter medication. List A. For list A, for the first consultation, video consultation is a must. But however, for follow-up, it can be audio, video, or text methodology. Coming to the list B. List B, any type of consultation, mode of consultation is allowed. However, the past 6 months, it has to be in person and only follow-up, the list B can be given. But however, remember, last one is prohibited. Under no circumstances, the psychiatrist will issue online prescription for these medications. Let's go into the list A. The list A has been clearly mentioned in the Telepsychiatry operational guideline based upon the best logical explanation. The list A is nothing but essential drug list which are notified under the Mental Health Care Act of 2017. This notification was issued on 16th August 2019. All essential drug list under the Mental Health Care Act will become list A. These are the list. This is available in the web notification. Again, please do remember, injections, online prescription shall be given by a psychiatrist to an RMP or a nurse. Don't give prescription online directly to the patient, especially the injections. At the same time, please do not give prescription for zolpidem, lorazepam, or else injection risperidone or olanzapine. All these requires a healthcare worker, and especially injection risperidone requires presence of a psychiatrist. But however, with regard to clonazepam and clobazam, there has been an amendment by the MCI, and they have allowed clobazam and clonazepam, although they fall under the Narcotic Drugs and Psychotropic Substance Act of 1985. These are list A. The only reason for list A has been these medicines because they fall under essential category. However, the author of this Telepsychiatry operational guidelines and his colleagues tried to classify many of the drugs into list A. Unfortunately, there has been any logical or reasoning was made available. It was difficult to think which will become list A and which will become list B. For example, for schizophrenia, the first line of treatment for a child is different, for an adolescent is different, a young lady is different, for a pregnant lady is different, for an elderly person is different. That means diagnosis is same. But however, depending upon the age, depending upon the pregnancy, depending upon various other factors, the first line of medication changes. The only prudent mechanism and the explanation of logically was understood by keeping all list A medicines coming under the essential drug list. Coming to the list B. List B are all other medications which do not fall under list A and list C, that is prohibited medication. However, the authors of the Telepsychiatry operation guidelines have clearly mentioned other medicines for antipsychotics, other medicines for antidepressants, similarly for anti-craving, anti-dementia drugs, anti-ADHD drug, mood stabilizers, beta blockers, and injectables. Here, others means basically any new medication coming not require any amendment. They automatically come under this category of other medications. At the same time, please do remember there have been parenteral injection which comes under the list B, such as zuclofentixol, flufentixol, haloperidol, and aripiprazole. These medications will be given to another healthcare worker via collaborative video consultation. Don't give parenteral injections prescription directly to the patient when an online consultation is done. Coming to the prohibited list, there are two important things you should remember in the prohibited list. Those medicines which fall under Drugs and Cosmetic Act of 1940 and Rules 1945, such as amphetamine, methamphetamine, dexamphetamine, encyclidine, methylphenidate, and many other medicines. Please do not prescribe online. They are completely prohibited. One more important category is NDPS drugs which are notified. Those medicines such as buprenorphine, methadone, codeine, tramadol, cannabis, benzodiazepines should not be again prescribed online. Both these groups have been clearly prohibited for online consultation prescription. But however, as I mentioned, there has been a clear MCA amendment with regard to phenobarbital, clobazam, and clonazepam. On 11th of 4, 2020, this notification was issued with regard to allowing phenobarbital, clobazam, and clonazepam can be prescribed for either the first consultation or follow-up consultation. And this has been done because many of the seizure patients require the NDPS medicines like phenobarbital, clobazam, and clonazepam that has been allowed under the MCA amendment on 11/4/2020. Let's look into the format of prescription. This is how the format of the prescription as per the Telemedicine Practice Guideline is made available. Please do remember when the prescription is written, you have to write about the chief complaints, relevant history, examination, lab findings, and also suggested investigation. Don't forget to mention about provisional diagnosis. And if you're able to arrive for a complete comprehensive diagnosis, it's well and good. Please document about the medications and also special instruction which has been mentioned. And in the bottom, you have to mention about whether this prescription was issued online or in person has to be documented. Now, coming to the final part of my presentation, that is medical legal issues in telepsychiatric consultation. Medical legal issues in telepsychiatric consultation are now becoming very common. Hence, you have to take certain important precautions. Encourage telepsychiatric consultation through appointment only. Avoid emergency consultation. Verify the identity of the patient. Identify yourself to the patient. For every consultation or every session before any therapy, please do check for whether there is a patient requirement for emergency consultation. At the same time, psychiatrist should ensure there is a mechanism for patient to verify the credentials of the psychiatrist. Presence of patient is essential during tele, follow-up, or in-person consultation. Whenever the psychiatrist feels that there is something wrong, please ask for in-person consultation. Encourage the patient and the patient party to fill the Appendix 1 and 2 for first consultation or follow-up consultation. Although they are optional, insist for them to fill this. If they are able to fill, your documentation becomes very easy. Further, please do follow Mental Health Care Act. Don't think that just by doing telepsychiatric consultation, you can forego Mental Health Care Act. No. Even if you are doing telepsychiatric consultation, you need to follow Mental Health Care Act. Although it is even a OPD basis consultation. Patient has a right to choose in-person consultation over telepsychiatric consultation. At the same time, the psychiatrist is also have a professional discretion to choose to provide teleconsultation or else in-person consultation. However, the psychiatrist cannot insist only on telepsychiatric consultation. If the patient wants to come in person, is allowed to do that. But again, a reasonable degree of care has to be taken to secure the patient's privacy and confidential data. In all case of emergency, the patient must be advised for in-person consultation. At the same time, before you refer them, please do first aid advice, counseling, and at the same time, referral should be given. And psychiatrist as a professional discretion to choose the mode of consultation. It can be text, audio, or video. And he can ask for in-person consultation at any stage. Issue prescription only after making a provisional diagnosis. Do not prescribe list C medications. That is prohibited list. Those medications which come under NDPS and also Drugs and Cosmetic Act of 1945. Explicit consent should be taken before you transmit the prescription to a pharmacy or to a third party. But however, this is one important area I felt that need to be discussed. A patient in conflict with law means patient has done something wrong and he is being required by the investigating agency. That is what we call it as in conflict with law. If a telepsychiatry is done and they are requesting for certificate, what has to be done? Person in conflict with law. Psychiatrists need to inquire for any legal issues in any consultation, either for the first consultation or follow-up consultation. As soon as he checks for emergency care is required, immediately he should jump into whether there is any legal requirement, whether they require any certificate, or else is there any FIR lodged against him. Those are the important information has to be sought out by the psychiatrist. It is the professional discretion of the psychiatrist to advise for in-person consultation or inpatient admission for a person who is in conflict with law, so that a comprehensive, complete assessment is done and appropriate certificate can be issued to the relevant authorities. However, please follow Mental Health Care Act before you issue a medical records. At the same time, if you have a doubt, consult a medical board before issuing any certificate on telepsychiatry. To conclude, my dear friends, before you start for a telepsychiatry consultation, identification of both parties are very essential. The psychiatrist will introduce himself. At the same time, he will verify whether the patient's ID matches with the patient. Proxy consultation, be careful. All proxy consultation for the first consultation request for in-person consultation. Authorization is a letter must for tele-follow-up in the absence of the patient. Legal issues are similar to in-person consultation. Just because you are providing telepsychiatric consultation, you cannot forego other laws. All in-laws which are applicable for in-person consultation is applicable for telepsychiatric consultation. Please do use telemedicine technology to provide psychotherapy. And don't forget to follow Mental Health Care Act. Thank you very much for giving your valuable time. Stay safe.